Next, I'll provide some insight on navigating coding criteria and psychological and neuropsychological testing. Let's begin by reviewing the applicable codes utilized for psychological and neuropsychological evaluation and testing. It's important to understand how to distinguish between codes for testing services, which ones cover the actual administration of tests, and those used for the evaluation process, which will also include clinical services provided by the provider or a qualified healthcare professional. I'd like to provide an overview of the key differences between these codes and guidance on when to use each appropriately. Firstly, we have CPT 96130 and the add-on code 96131, which identify as a psychological evaluation. Psychological evaluation is the professional services provided in conjunction with testing to assess emotional, interpersonal, intellectual, and personality functioning, including thought processes and any psychopathology. 96130 is used for the initial 31 to 60 minutes, with the add-on code 96131 used for each additional 31 minutes past the initial hour and services performed on subsequent dates. Next, we also have 96132 with its add-on code 96133 used for neurophysiological evaluation. Neurophysiological evaluation is the professional services provided in conjunction with testing to assess multiple, often overlapping domains, including intellectual and executive function, language and communication, attention, memory, visuospatial, and sensory motor functioning, as well as relevant psychological factors. 96132 is used for the initial 31 to 60 minutes, and add-on code 96133 is used for each additional 31 minutes past the initial hour and services performed on subsequent dates. Finally, we have CPTs 96136 through 96146. These are used for psychological or neuropsychological testing. These are specifically test administration codes, which apply to both psychological and neuropsychological testing. These codes vary based on factors such as the individual who's administering the test, such as a provider, QHP, or technician, and the number of batteries or tasks involved, and the method of administration. 96136 is used for the test administration by a provider or QHP with 2 or more batteries via any method, and that includes 16 to 30 minutes. We also have the add-on 96137, and it's used for each additional 16 minutes past the initial 30 minutes. 96138, in contrast, is used for test administration by a technician, such as an MA, RN, or other trained professional with 2 or more batteries via any method, and that's for 16 to 30 minutes. Add-on code 96137 is used for each additional 16 minutes past the initial 30 minutes. 96146 is used when we have a single battery that is administered via an electronic platform. Keep in mind there are many differences in payer specifics for the approval and application of these codes, which we'll go into next. So what factors might lead a payer to approve 96132 versus 96130 for neurophysiological testing, and how can providers anticipate which code to use? There are a few key factors that can affect payer approvals, including the test type, coding differentiation between CPT codes 96130 and 96132 may be based on the type of testing performed, as earlier described, which is in alignment with the general CPT coding guidelines. Additionally, we have provider specialization to consider in addition to the test types. Providers are often used as a distinguishing factor between the psychological and neuropsychological testing codes based on their specialization, performing that evaluation, such as the neurologist, psychologist, psychiatrist, or the neuropsychologist, along with any specific training or credentials that the provider holds. Or it could be based on focus and range of the function assessed. For instance, they may also consider the diagnosis or symptoms and the associated brain regions of that condition being evaluated to determine the appropriate codes. In addition, we have payer-specific guidelines Payers often will have their own specific guidelines on code selection and qualification. These nuances highlight the importance of reviewing payer policies before billing and submitting claims for these services. Keeping payer specifics in mind, it's also important to be aware of code bundling and service separation, which we'll go into more detail about shortly. In addition to selecting the correct codes for neuropsychological and psychological testing, understanding who is eligible to perform and bill for these services is essential for ensuring compliance and optimizing reimbursement. One of the key questions is, which providers can bill for CPT codes 96130 and 96132, and what credentials or supervision requirements apply? According to CMS guidelines, a physician or psychologist isn't always required to perform or directly supervise these evaluations. Non-physician qualified healthcare professionals, or QHPs, such as nurse practitioners, clinical nurse specialists, or physician assistants, can also conduct these evaluations if their scope of practice permits. In states where QHPs must collaborate with a supervising physician, general supervision is often sufficient for reporting these services. General supervision means that the service is provided under the overall direction and control of a physician, but the physician does not need to be physically present during the procedure or service. However, clear documentation is critical. The medical records should specify when general supervision is applied, providing transparency and avoiding potential payer denials. It's also important to consider payer policies will vary. While CMS allows flexibility, individual payers may impose additional restrictions which providers can bill for CPT 96130 and 96132. For example, some private payers may require a higher level of supervision or limit billing to a specific credential, even if CMS guidelines are more lenient. To avoid claim corrections and rejections, thoroughly review payer-specific requirements before submitting claims. This ensures compliance with both documentation standards and coding expectations. By aligning provider credentials, supervision levels, and payer-specific rules, we can support accurate billing while reducing the risk of denials and audit issues. Now that we've reviewed the key stages and coding guidelines, let's bring it all together with a clinical example. Let's consider a 25-year-old female presenting with persistent issues related to distractibility, difficulty organizing tasks, and raising concerns for ADHD. The care episode begins with utilization of Cryos Health's ADHD protocol. Testing is administered by a technician under the supervision of a provider. The provider also conducts a thorough evaluation, reviewing the patient's history, ensuring proper test setup, and contributing to clinical decision making. On a subsequent date, the provider then interprets the test results, confirming a diagnosis of ADHD. This leads to the development of a tailored treatment plan, which includes medication management. The care episode concludes with a feedback session provided to the patient, followed by a post-service work such as finalizing the documentation and sharing the report. In this scenario, the provider documents a total of 95 minutes for the evaluation, with an additional 25 minutes allocated for test administration by the technician. An appropriate code in this case to use would be 96132 for the neurophysiological evaluation by the provider for the first hour, and also the add-on code 96133 for the additional 35 minutes spent exceeding that 31-minute threshold for the add-on codes. Additionally, 96138 is used to report technician-administered testing with a total administration time of 25 minutes, all of which are consolidated into a single claim and submitted after completing the care episode. This workflow aligns with CPT and APA coding guidelines, ensuring compliance and accurate reimbursement. It's also important to keep in mind this is just one example of how clinical workflow could be structured, and it highlights the importance of adapting to payer-specific requirements and individual practice needs. Depending on these factors, steps, coding, and even outcomes may vary significantly. By applying these principles in your practice, you can ensure precise documentation, streamline coding processes, and deliver high-quality, patient-centered care.